Did you know that Medicare is not free? If you're getting ready to go on to Medicare or you're thinking about going on to Medicare, one of the most shocking things to you might be to find out that Medicare is actually not free, that it is going to cost you money out of pocket. I was just talking to someone else again recently, and they said that was one of the most surprising things to them when they started Medicare was how much it was going to cost them out of pocket. So, yes, despite what politicians and people in the media say, Medicare is not free. And so we're going to talk about that in today's video. My name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people all over the country understand how the Medicare program works, as well as connect them with the coverage that fits their needs. In today's video, my goal is to help you understand the cost for Medicare in 2024. And I do want to say 2024 because we're getting down to the end of the year and these costs will look different in 2025. So if you're watching this video in 2025, hopefully there's a new video that I've put out since then. But I'm going to share my screen with you and just give you kind of a general understanding of the costs that you are going to pay once you start taking Medicare. So let's jump over to the Medicare website and we're going to look at the costs for Medicare. And I will put a link to this page in the description of this video so you can look at it and review it at your convenience. So the other thing that we're going to learn about in today's video is the different parts to Medicare. So a lot of people say, what's with all the parts? What are the parts of Medicare? So we're going to learn about the cost, but we're also going to learn about the parts to Medicare. And there's only 4 parts, and it's once you see this, I don't think you'll think it's very complicated anymore. It's pretty straightforward. But as you can imagine, we're going to start with Part A. Medicare Part A. So Medicare Part A is what's known as your hospital insurance. Most people do not pay a monthly premium because they or a spouse paid Medicare taxes long enough while working, generally at least 10 years. So for most people going on to Medicare, when they sign up for Part A, they're not going to pay a monthly premium. However, and this is important, there are some other costs that can arise on with Part A, I should say. For instance, if you were to be admitted into the hospital and need inpatient hospital care, there is a deductible in 2024 of $1,632. Now, the thing that you have to understand about that is a benefit period is not the same as the year, meaning that if you were admitted into the hospital and you had to pay that Part A deductible, that is not for the year, that's for a benefit period, and you can have more than one. And I'll show you this little pop-up right here that explains it. So basically it says the way that original Medicare measures your use of hospital and skilled nursing facility services. That's what they're defining is the benefit period. A benefit period begins the day you are admitted as an inpatient in a hospital or skilled nursing facility. The benefit period ends when you haven't gotten any inpatient hospital care or up to 100 days of skilled nursing care in a skilled nursing facility for 60 days in a row. Now here's what's important. If you go into a hospital or a skilled nursing facility after one benefit period has ended, a new benefit period begins. You must pay the inpatient hospital deductible for each benefit period, and there's no limit to the number of benefit periods. So I've met some people along the way doing this who only have original Medicare A and B. We haven't talked about B yet, but they signed up for original Medicare A and B, and that's all they have. Well, here's the problem with that. The problem is that they may not realize these extra costs if you go into the hospital under Part A. And as you can imagine, it can get pretty expensive. So if that's you or someone you know, this is definitely something that you're going to want to be aware of, because as we're going to find out, if as we scroll down, depending on how long you're in the hospital, you might have to pay a co-payment for each day. Now again, days 1 through 60 are covered after you meet the deductible, but if you were to be in the hospital for 61 days, you would pay a co-payment of $408 each day. And if you happen to be in the hospital for 91, it jumps to $816. And if it's more than 150, you pay all costs. Also on skilled nursing, days 1 through 20 is covered, but days 21 through 100, $204 each day. Days 101 and beyond, you pay all costs. So again, there's people out there, they just have original Medicare. That's all they have, and they're not aware of these financial exposures that they have. So if that's you or someone you know, pass this along to them. Okay, so let's jump over and now talk about Part B. Part B is known as your medical insurance. So we're just going in order here. So A is hospital, B is medical. So with Part B, most people pay the standard $174.70 each month. However, that can be higher depending on your income. Also, the amount can change each year, as it usually does. You'll pay the premium each month even if you don't get any Part B covered services. So most people, again, will pay that $174.70 a month, and it doesn't matter whether or not you use it, you still have to pay for it. Also, there is a $240 deductible on Part B, and you have to pay this deductible each year. So that is an annual deductible. Now, here's something else that a lot of people don't realize. With just original Medicare, usually you'll have to pay 20% of the cost for each Medicare covered service or item after you've paid your deductible. And so that's something that people don't realize. Yes, you're paying that $174.70 each month even if you don't use it, but it covers 80%. You still have to pay the 20. So that's something that you also need to be aware of. Also, as you can imagine, if you do go into the hospital, there is some out-of-pocket you might pay, because, as you can imagine, when you're in the hospital, you're going to see a doctor, right? And so you're going to have to pay some out-of-pocket for that. If you spend time in an outpatient mental health care, you're going to have to pay for some of that. Again, the general thing to remember, though, with Part B is that there is a 20% exposure, generally speaking, to out-of-pocket costs. And so I've talked to people before, and they say, well, what do I need anything else for? I've got Medicare. What else do I need? Well, this is a great example of the financial risk that you face if you just do original Medicare. Okay, so we're going to talk next about Medicare Advantage and Medicare Supplement. So these numbers are going to be a little bit more vague because I'm not going to actually share quotes with you. I'm also really not going to talk about the differences between how these work. But what you need to know, generally speaking, is that with a Medicare Advantage plan, this is an alternative to your original Medicare. So you can either use original Medicare or you can use Medicare Advantage. You can't use both, even though you have to pay for your original Medicare. So with a Medicare Advantage plan, the premiums and the other costs like deductibles, co-payments, and co-insurance, there's a variety of costs that come with a Medicare Advantage, and it varies by plan. These amounts can change each year, and so if you want, you can always go to Medicare.gov, and you can always look at the plans in your area by clicking on this icon right here. You can do this with an account, you can do it without an account, and so you can start to get an idea of what that Medicare Advantage plan is going to cost you. Now, the thing you have to remember is that there's also an out-of-pocket limit. So there's usually a premium, there's usually deductibles, co-payments, co-insurance, and there's an out-of-pocket limit. Your out-of-pocket limit might be $3,000. Your out-of-pocket limit might be $10,000. So when you're trying to determine the costs for your health insurance, once you're Medicare eligible, these are some of the things that you have to consider. And again, you must have Part B and keep paying your Part B premium to stay in your plan. And the other thing to note is that once you pay the plan's limit, the plan pays 100% of your covered health services for the rest of the year. So a lot of times you'll see people and they'll say, "Oh, I don't pay anything for my plan because they have a $0 premium." Well, that's not actually accurate because they could have deductibles, co-payments, and co-insurance. Next, Part D drug coverage. So, if you choose to do original Medicare and a supplement, which we haven't talked about yet, we're going to get to that, you'll want to get a Part D prescription drug plan. Most Medicare Advantage plans have prescription drug coverage included in that. And so if you do original Medicare and you pick up a supplement, um, then you're going to want to get a Part D prescription drug plan. Again, these vary by plan. You may have to pay more depending on your income. And the other thing that I'll mention is um, you want to compare the costs and coverage. And here's the reason why. When you're looking at prescription drug plans, and let's say you do it right here on the Medicare website, and you just look at the premiums, that's not a full picture, right? Because you have to consider the fact that, yes, you may have a low monthly premium, but what prescriptions do you take, and how are those prescriptions covered under the plan's formulary? Because every Medicare prescription drug plan has a formulary. It's a list of drugs and what level, they call it tier, they cover that drug at. So if you're in tier 1 and 2, it's more of a generic, then your costs will be low. If you start getting into tiers 3, 4, and 5, your costs are going to go up. So it's not just that monthly premium, it's also, again, the deductible, the co-payment, and the co-insurance. And then last, what we'll talk about is Medicare supplements. So Medicare supplements do have a monthly premium. So if you're tracking along and trying to understand your costs compared to maybe your employer plan or your private health insurance plan you have now before going on Medicare, you're going to have that 174 a month, right? If you do a supplement, you're also going to have a premium in addition to that depending on which one you choose. And the plans vary based on which Medigap policy you buy, where you live, and other factors. The amount can change every year. And here it is again. You must have Part B and keep paying your Part B premium to get your Medigap policy. So, when you're talking about Medigap, it's the same as Medicare Supplement. It's simply an insurance policy that you can buy to help lower your share of certain costs for Part A and Part B services. The other thing to remember with Medicare Supplement is if you use original Medicare in a supplement, as long as the provider takes Medicare assignment, they will take your Medicare supplement. The Medicare supplement just follows original Medicare. Some talks a little bit here in detail that some Medigap policies include extra benefits to lower your costs like coverage when you travel out of the country, etc. I won't go into that in today's video, but there you have it. There are the different parts of Medicare and the costs. Again, once you start to investigate this and learn about this little, it's pretty straightforward. Really, the question that you want to decide is, do you want to use the original Medicare network, or are you comfortable using a Medicare Advantage where you might have to stay within a specific network? Not going to go into that in today's video. I have other videos about that, but if you enjoyed this video, please hit the like button, pass it along to a friend. And if you have questions about Medicare, please leave me a comment below, or you can also reach out to me through my website. Again, it's just meetjamie.com. Thanks for watching. We'll see you in the next one. Have a great day.